Oh wow, amazing. Thank you ever so much for coming today. This is a really important day for us and for the people living with allergy in the UK, so we're really privileged that you're here. For those of you who don't know me, I'm Carla Jones. I'm the Chief Executive of Allergy UK. And to start with just a bit of housekeeping, the speeches will be recorded today, and the videographer will indicate as soon as recording is stopped, which will be at the end of the speeches. And the reason we've done that is because actually we were oversubscribed with the numbers of people that wanted to come today to capacity. So we're taping this today, the speeches, and it will go out at 4 o'clock today to all those who asked to come, but we're on the reserve list and we couldn't make it. So please bear with us. I hope everyone's happy with that happening. So on behalf of Allergy UK, we would like to thank all of the parliamentarians, patients, trustees, clinicians and other partners who are here today. Together, I hope we can realise Allergy UK's mission, and that is for everyone in the UK to start taking allergy seriously and achieve our vision that no one else should die from allergy. This vision is particularly poignant in light of recent press coverage around the awful news that a young man, James Atkinson, just 23, died from allergy last year, and his inquest has just been talked about. And there have been too many tragic deaths, and allergy is still not taken seriously enough, as we know. The World Health Organization has described allergy as a modern epidemic. Yet, disappointingly, the urgency of the World Health Organization's statement hasn't been matched by the response. Through today's reception, we want to put allergy in the spotlight and highlight why it's important to take allergy seriously. And I want to introduce first speaker, which is John Cruddas MP. John has kindly hosted the event today and made today possible. He's the chair of the All-Party Parliamentary for Allergy. He's been a steadfast supporter of People for Allergy for numerous years, and he's championed allergy in Parliament for a long time and helped to highlight the huge gap in healthcare provision for people with allergic disease at every property. Thank you. Thanks, John.
Good afternoon, everybody. My name's John Cruddas, as was said. I'm MP for Dagenham and Rainham and chair of the All-Party Group on Allergy. And it's a real pleasure to host Allergy UK's Parliamentary Reception here this afternoon. So, first of all, welcome to you all, and thanks for attending. Excuse me if I start coughing, because my hay fever kicked in about an hour ago, so it's impeccable timing. So I think that's happened to a few of us here today. Allergy UK is the UK's leading patient charity for people living with all types of allergy, and works to help improve the lives of millions of people with allergic disease. Through its fact sheets and helpline, it provides free help and support to numerous people with allergy, their friends, family, and wider support networks. This is a service that is desperately needed. So look, the first thing I want to do is place on record thank you for everything that you do. Because, as Carla said, we do face a national allergy crisis, an epidemic in allergic disease. 20 million people in the UK living with allergy. 5 million of these have allergies severe enough to require specialist care. Yet, as patients here will testify, our allergy service remains inadequate and hard to access. Change is required and indeed long overdue. It's frightening to live with a condition which could cause a severe or life-threatening reaction at any time. We all know recent high-profile tragic cases of fatal anaphylaxis have exposed shortcomings in NHS service provision. As chair of the All-Party Group on Allergy, I've been working with Carla Jones, Chief Executive of Allergy UK, to ensure government and the NHS give allergy the appropriate priority it deserves. The All-Party Group on Allergy, in conjunction with the National Allergy Strategy Group, recently published Meeting the Challenges of the National Allergy Crisis. Amongst our proposals, we call for a national plan for allergy led by designated civil servant or lead, an expansion of the specialist workforce, and to ensure all GPs and healthcare professionals in primary care have knowledge of allergy. And following with meetings with ministers, we now have a work programme and an ongoing dialogue which hope will bring rewards, meetings with civil servants and representatives of the NSSG. And I believe for the first time we have a minister that is genuinely interested in preventing allergic disease. And today is the launch of Allergy UK's patient charter, which has been developed by allergy patients and the families themselves. And the patient charter sets out the right to high quality standards of care, the right to accurate information and education, the right to equality in society with greater allergy awareness in society so that people can go to school, to their workplace, eat and travel without fear of an allergic reaction. It's a great initiative, and I would encourage all parliamentarians to sign up to the Charter and pledge to become an allergy champion. And we've had quite a few in today already, which I think is a great start. Patients should not have to wait any longer for change. So thanks for everyone for everything that you're doing. I think we can really look forward positively to the next year. I think we've got some strong footings in the ground, which we haven't had for a few years, with this ongoing national dialogue and with relations with the Minister that we haven't had for a very long time. So all power to your elbow, Allergy UK. I think we will go from strength to strength. Congratulations on the launch of the Charter today. And with that, it's my great pleasure to introduce Louis French MP, the Conservative MP for Old Bexley and Sidcup, where Allergy UK's headquarters is based. Louis, all the chairs and places.
Oh, good afternoon, everyone. Like John, my own hay fever has started really badly, but it's been great to be here actually and to speak with many of you like I always would do, but actually to learn something about my own allergies, as I've done already, which is learning something new every day, Carla. But like I said, thank you very much for inviting me to speak and to say a few words. First, I'd like to say a massive thank you to Allergy UK, like I said, for inviting me here today, as well as for asking me to contribute to this incredibly important discussion. As the local MP for Sidcup, as John said, where Allergy UK's headquarters are based, I'm delighted to be here to support their efforts to raise awareness of some of the key issues that allergy sufferers are facing. I'm also very happy to pledge my support for the Patient Charter and would encourage my fellow parliamentarians to also do so by signing the pledge board, and like John said, it's been good to see a few that have been in already. With hay fever season now upon us, many hay fever sufferers like myself will only be too aware of how allergies can affect our daily lives. Whilst for many of us hay fever causes only mild discomfort, there are also many for whom an allergic condition can be life-changing and significantly impinge upon the quality of their life. There has been a staggering, and I was staggered when I saw this percentage, 615% increase in hospital admissions as a result of anaphylaxis during the last 20 years. And allergies and related conditions are estimated to cost our NHS around £1 billion per year. Staggering figures. Yet to the frustration of patients and their families, allergies are often not taken seriously. One parent of a child with multiple and severe food allergies told Allergy UK that every meal is a source of constant anxiety and fear. We need to do more to ensure that parents can feed their children without fear of anaphylaxis, illness, and in the worst case, death. Allergy has rightly been described as a modern epidemic, and the tragic recent high-profile deaths from allergy, which are sadly all too avoidable, have underlined the imperative of taking allergy seriously. There remain huge challenges in the NHS in terms of diagnosis, treatment and management of the full range of allergic disease, encompassing all degrees of severity, from mild to moderate to acute, including anaphylaxis. For many patients, access to good allergy services, particularly at primary care, is the postcode lottery, with patchwork provision across the country and the quality of local services for a patient being more indicative of their location rather than their need. One of the biggest gaps, and arguably the most solvable, is in training of the condition. And while some progress has been made in recent years, there remains a shortage in allergy specialists and immunologists with allergy services throughout the NHS. We need to invest in training and recruiting more specialists in allergy across the NHS to help those patients most in need. I welcome that the government has responded to the allergy crisis our country faces, as John said. We have an excellent minister now taking this very seriously, and placed a focus on allergy in recent years, announcing investment into research for food allergies, as well as the introduction of Natasha's Law in response to the tragic death of Natasha Ednan Laperose, creating a legal requirement for all food resellers and operators to display full ingredient and allergen labelling information on every food item they sell pre-packed for direct sale. Our next priority should be funding the expansion of specialist allergy workforce and expanding allergy training to those already qualified GPs in our communities. There is much work to be done. Establishing a national allergy strategy and a national clinical director for allergy, alongside the current immunology lead, would put in place a dedicated champion for patients with allergy within the NHS structures. I am delighted to be Allergy UK's first Conservative allergy champion, as I've been reminded, and I look forward to continuing to work with Allergy UK and other organisations here in the room today to ensure that this issue remains high on the government's policy agenda. Thank you once again for having me today, and I hope that you all enjoy the rest of the event. Thank you very much.
And John, of course, is the first Labour allergy champion, and we will have all-party, cross-party champions because we are non-party specific. It's about allergic disease, but it's fantastic to have you all engaged, so thank you. Thank you, Louis, for highlighting the ongoing challenges that people with allergies are facing. I think loads of us in the room who live with allergy or work within allergy will know that it has a huge impact on the quality of life people, and we sadly hear about these deaths, but actually majority of people live with allergic disease and it impacts on their quality of life daily. It can be unprecedented with its impact, it can be fatal, but it's actually living with the disease that has the huge psychological and physical and other impacts, not just on the person with that disease, but on their family around them. That said, I want to introduce you to a wonderful young lady, and now I'm going to cry, Ella, because we were crying earlier, now I'm going to cry. I always cry at these things, sorry, because it means a lot to me. I now want to introduce Ella Stoneham, who's going to share her own experiences as a young person grown up with severe allergies. Ella and her family, Sarah, her mum, have been involved with Allergy UK for decades, for a long time. Sarah was a trustee for a very long time and only stopped because she'd served her term under our terms of reference and M&A. But Ella's done podcast videos and been working with us as a charity since she was a small child. But she lives with this disease and it's her that's important today. So Ella, please, can I welcome you up?
Sorry if I get a bit emotional. Good afternoon, my name is Ella Stoneham. When I was born, it became apparent quite quickly that there was something wrong, as I became increasingly unwell, and at 6 months old, I was diagnosed with a milk and egg allergy. When I was 2, I was diagnosed with asthma as well, which is triggered by a number of things, including allergens from cats, dust, and pollen. Over the years, rather than growing out of my allergies, they have become increasingly severe, and now, even if I have the tiniest amount of milk or egg, I can suffer from anaphylactic reactions. It is very hard for people to understand that something that seems so harmless and normal for most people can be so dangerous for me. My first anaphylaxis happened when I was just 18 months old. It is extremely frightening to have a reaction like that. Anaphylaxis is very dangerous and potentially fatal, so as you can imagine, it has had and continues to have a huge impact on my life. My everyday life has always been carefully managed to try and reduce the risk to me of anaphylaxis or an asthma attack. But even still, I have had quite a few severe reactions without ever really knowing what specifically caused them. When I go out to eat, I always have to explain my situation. I find it embarrassing and sometimes distressing. It isn't nice to be different to everyone else or to not be able to join in something my friends are doing because it isn't safe for me. An example being, I went to a coffee shop with my friends and this caused me a severe reaction simply from being there. There was so much milk in the air, so I was blue lighted to hospital. I hate always having to explain myself or put my trust in people I have never met before. Increasingly, people are more aware, but I have been excluded and mocked or ridiculed. I have had anaphylactic reactions in restaurants where they made a mistake. I've had anaphylaxis at school because the adults in charge of me did not take the situation seriously enough. And I have had anaphylactic reactions where I have never been able to find out why. I carry my EpiPens and inhaler everywhere. I have used them so many times I have lost count, and sometimes I have had to use 2 because one was not enough to stop the reaction and save my life. Many of my reactions have been traumatic, and I have high levels of anxiety and PTSD as a result of some of the more severe reactions. I have panic attacks when I don't feel safe or when something triggers my anxiety. That could be as simple as seeing someone near me eating an egg. I'm now 21, I have lovely friends, a great social life, I work and go to university, and I'm well aware of how to manage my allergies and how to administer my EpiPen, but the impact on my everyday life remains constant. The impact on my mental health is substantial, and the outlook for me is that this will not change. I'm very determined to live my life positively, but that does not diminish the burden of my situation. I am not alone. Millions of people across the UK are living with allergy, yet there is much more that can be done and should be done to support them. Allergy UK's patient charter was constructed in collaboration with patients like me who have lived with the burden of allergy for far too long. We need a gold standard of care, empowerment to help people to understand their conditions with the right support of healthcare professionals and to end the discrimination of allergy patients. I urge all of you here today to fully support Allergy UK's patient charter, which gives patients like me a voice. I want to thank Allergy UK for the opportunity to speak to you today and wish them the very best of luck with the patient charter.
I don't really have to say anything else, do I? But they've written notes for me, so I'm just going to sort of say the final bit, but thank you, Ella. Yeah, as ever. She's amazing, amazing. As are some of the other young people here, Arlo and that, who work with us and who live with the disease and their families. Amazing, amazing. So we're really proud as Allergy UK to be leading patient or charity in the field of allergy, advocating on behalf of patients and their families. As many of you know, we work with government, professional bodies, healthcare professionals, other partners in industry who are really supportive to try and improve the lives of millions of people with allergic disease. We've been in place for over 30 years as Allergy UK, and we provide support and advice to people with all types of allergy. We're the only patient organisation that does support all types of allergy, from food, respiratory, skin, eye, drug and venom allergies. And that includes those people whose allergies are so severe that they have anaphylaxis, anaphylactic reactions. Our dedicated helpline is there and answers and supports about 4,000 calls a year from people living with allergy. And our fact sheets and help sort of support on our website are downloaded, but just under 100,000 copies a year. So, you know, our services are used, and that's with support for people. But they provide people with information that's greatly needed to explain symptoms and triggers that impact on their daily lives. And we talk about how we fill the gap. Allergy UK fills the gap because actually our primary community care don't have that experience and knowledge, because there aren't enough of the specialist care providers, specialists in allergy, to actually for referrals because of waiting lists. So people can't get that sort of diagnosis and treatment. So they come to us and we fill that gap to meet the needs of individuals and the families because of that dearth of services. And this has been going on too long. And it's remained allergy a poorly recognised and often misunderstood health condition. So despite the 3 decades of lobbying and in some improvements, which we have made improvements with the NASG and our partners, which is the British Society of Allergy and Clinical Immunology, and with Anaphylaxis Campaign as the NASG, we've worked together and we've made improvements. But sadly, allergic disease is still not taken seriously enough. And at the same time, during the last 60 years, allergic diseases have increased globally in prevalence, complexity and severity, and it is a global public health concern. In the UK, they say 44% of adults, so 21 million people, and 50% of children have one or more allergies. Allergy UK, during the latter part of last year, undertook a piece of research that actually involved 7,000 participants, of which 3,000, it was a general public, and of which 3,000 identified themselves as having allergy. And we're just looking at analysing all that data right now. But if you take that data and expand and sort of analyse it, it actually probably comes out as suggesting about 41 million people now live with allergy. 21 million being the approximate number of people with allergy was, I think, from the early 2003, 2004. And we're now 2022, and we know that those numbers have increased, and our research is showing that. So, this the increase in allergy is also reflected in parliamentarians too, because in February we did a survey with the MP parliamentarians here, and our own recent survey shows that 30% of MPs have an allergy, and 2/3 have a close family member with allergy. So actually it is time that we took allergy seriously. And I think, I'm sorry we started late today, but that's because you saw the stream of MPs coming in to actually discuss, and every single one of them said, I live with allergy, or my family do live with allergy. So actually they are taking it seriously, and hopefully we can move forward from this. So this is a clear case for change. And that's why with patients, parents with young children live with allergy, and with leading clinicians from across the UK, we work together with focus groups, taking messages from some of our research, and actually from that introduced the patient charter and developed the patient charter. It was the brainchild of our head of clinical, Amina Warner, who thought this is what we need, this is the next step we need. And so from that research, we have actually, with patients, with clinicians, pulled together this patient charter. It sets out 3 key principles, as you've probably seen on the signs and around: a right to quality of care for everyone with allergy throughout the UK to get timely diagnosis, access to the best possible evidence-based treatment where available, and access to services. The right to accurate information and advice to empower patients with allergic conditions to understand and manage their condition with support from informed healthcare professionals. That's not just GPs, that's all healthcare professionals. That's whether you're a midwife, a health visitor, a dietitian, a pharmacist, a GP, somebody in specialist care, somebody in tertiary care, or whether you're a clinical psychologist. I'm just looking at you there. But it's actually really important that all of them have that understanding about allergy. And finally, the right to equality in society. We still hear at Allergy UK about children in school who are actually made to have their lunches outside of everyone else in the school because they've got allergy. I mean, it's outrageous. It's unacceptable, it's outrageous, and it's discrimination. And it shouldn't be happening, because those schools should be managing that allergy, and that's just one example of what we hear. So the right to equality in society, to promote a better awareness and understanding of allergy so that people with allergic conditions don't feel discrimination against any aspect of their daily lives. And that includes the right to eat out confidently, to go to school, university and travel, knowing that needs are being managed. So we're delighted that you could all join us here today for the launch of this patient charter. Our research and our campaign over the next 18 months of It's Time to Take Allergy Seriously starts today. Well, it started actually at the national conference last week, but it's our patient charter being launched today. That's the patient voice. And I'd encourage all parliamentarians here today and all of you to pledge your support to the patient charter and to show that it's time to take allergy seriously, so that millions of people living in the UK with this long-term health condition have access to high-quality care wherever they live in the UK and feel equal in society that takes their healthcare needs seriously. So thank you.